thank you so much, Secretary Becerra, for joining us here today. I truly appreciated, as we opened our hearing today, your summary of how both congressional Democrats and President Biden and his administration have worked to actually bring down the cost of prescription drugs, have worked to make sure that more people have access to health care. And while we've been doing that and so much more for American families, rural communities, and just this country in general, we have done so much. We've also been doing it at the same time that we've been reducing the federal deficit by $1.7 trillion in 2 years. So the right administration, Democrats in the Senate and House, leads to both fiscal responsibility and paying attention to what our families need. But you know, I represent rural communities. You've been out to my district, and there is a huge need for better health care and better access to resources. I want to talk about one of the little problems, and that is that it's often very difficult for these smaller communities, these smaller organizations, to actually apply for competitive grants for alcoholism, substance use disorder and treatment, and those kinds of things. We have organizations that say, I have to pass up this because I don't have the capacity. And so I am constantly asking, what can the administration, what can HHS do to provide the assistance so we get those kinds of projects and programs actually operating in our smaller rural and frontier communities?
Congresswoman, thank you for the question, because you're right. It is difficult to compete against the big guys, especially when you're in a distant location. We are trying to work closer with rural America to try to make some of these resources available. Some grants are designated to go into rural America. We are working very hard to try to keep some of the authorities and services that have really helped rural America. For example, telehealth, which was one of the greatest godsends for men and women, families in America, rural America, who during COVID could not really go visit physically their healthcare provider. Telehealth has been instrumental in helping a lot of these families stay in better health. And so we're going to do everything we can to try to help in that regard. But you're right, when it is a competitive grant, Congress, you all determine how that grant is administered. We try to make sure everyone can be competitive. So we do, for example, offer training and assistance for those who wish to compete for some of those grants so they can try to compete against the big guys.
Right. And the more assistance you can provide sort of from the executive on that would really be helpful so that we can have more of the rural areas. I mean, this administration and Congress last cycle did so much for rural America. I put together pamphlets so that I could go out into my district and say, look at everything we've done in rural America. Part of the problem that we still need to look at is rural hospitals. Like, too many hospitals in rural America are closing their OBGYN or cutting their hours. And I know we have the new Rural Emergency Hospital designation, which is going to be very helpful as it increases Medicare reimbursement. But I'd love to brainstorm with you a bit about what else can we do, because hospitals that provide inpatient care are ineligible for 340B, which is a major source of funding. So do you have some ideas on how we could increase the success of our rural hospitals?
So we've already had plenty of discussion about 340B and how we have to try to preserve it, but take away the elements that keep prices from coming down and being utilized by more providers. What I would say to you is one thing. I would love any member who would take me up on this offer, and that is to try to make sure that our graduate medical education slots, the residency slots that are used to train upcoming physicians, that we're able to place more of these in places like rural America, inner city America, because what we're finding is that if a budding doctor goes through his or her training in a particular location, after 2 or 3 years of that residency, there's a good chance that they like where they've been working and they will stay. And now you have created a new resource for those communities in rural America, for example. And so we're trying to direct where we can a focus on underserved areas to place some of these graduate medical education slots. We're also, for example, trying to beef up the number of slots we have in our Public Health Service Corps, where if you commit to provide 5 years of service as a doctor after you graduate from medical school and residency, we will pay for your medical education. My son-in-law is right now practicing in Salinas, California as a pediatrician. He got 4 years of medical school paid for by the federal government, but now he's committed to serve in that underserved area of Salinas, California for 5 years.
Thank you very much, Mr. Secretary, and I really do appreciate how we are having a world focus with this administration. Thank you.
Mr. Williams.